Wheelchair scales are essential tools in healthcare facilities. They offer increased accessibility for patient weighing, but there are several things users must keep in mind for accuracy and safety. The scale must be on a flat, solid surface. Ramps cannot come in contact with anything, including the floor, when a patient is on the scale. Ramps should be easily accessed by the healthcare professional. Keep the scale clean and clear of debris, and check that batteries are charged or use the scale's AC adapter. Check that the scale is set for the desired unit of measure. All accessories, such as blankets, coats, and bags, should be removed from the wheelchair. The empty wheelchair should then be placed on the scale and the weight of the wheelchair tared. This will display the weight as 0.00, which means when you weigh the patient in the wheelchair, only the weight of the patient will be displayed. Never leave the patient unattended while using the scale. Never overload the capacity of the scale, as this can damage the weight sensors and return inaccurate weights. Proper usage and care are essential to ensuring scale accuracy for all wheelchair scale models, and it can help medical professionals provide excellent patient care. Learn about all of Rice Lake's health scales at ricelake.com/health.